Every 40 seconds, someone in America has a stroke. But here's what's truly shocking. Most people believe myths about stroke that could cost them their life. If you think stroke only happens to the elderly, that warning signs are always obvious, or that recovery has a limited window, you're not alone in these dangerous misconceptions. Today, I'm going to reveal 10 critical myths about stroke that millions of people still believe. And I'll share the evidence-based truth that could save your life or someone you love. I've gathered information from the world's leading medical institutions, including the Centers for Disease Control, the World Health Organization, Harvard Medical School, and peer-reviewed research published in top medical journals. By the end of this video, you'll understand your real stroke risk, recognize the warning signs that doctors want you to know, and discover prevention strategies that are backed by solid science. Let's start with the most dangerous myth of all, that strokes only happen to older adults. This belief is not just wrong, it's potentially deadly. The National Institute of Neurological Disorders reports that stroke rates among people under 65 have increased dramatically over the past 2 decades. About 1 in 7 strokes now occurs in people aged 15 to 49. And the Cleveland Clinic has documented that stroke is among the top 10 causes of death in children and adolescents. Why are younger people having more strokes? The American Heart Association points to several alarming trends. High blood pressure, once considered an older person's disease, now affects nearly half of all American adults, according to CDC data, including a growing number of young adults and even teenagers. Type 2 diabetes, traditionally diagnosed in middle age, is increasingly common in people under 30. The obesity epidemic that the World Health Organization calls a global crisis doesn't discriminate by age, and excess weight significantly increases stroke risk at any age. But there's another factor that many young people don't realize: substance use. Research published in the journal Stroke found that recreational drug use, including cocaine, amphetamines, and even marijuana, contributed to nearly 20% of strokes in people under 45. Excessive alcohol consumption, binge drinking, and the combination of oral contraceptives with smoking create additional risk factors that disproportionately affect younger populations. The second myth we must address is the belief that genetics determine your stroke fate. While family history does matter, the National Stroke Association emphasizes that up to 80% of strokes are preventable through lifestyle choices. This means you have tremendous power over your stroke risk, regardless of your family history. Blood pressure management stands as the single most important factor you can control. The American Heart Association calls high blood pressure the #1 modifiable risk factor for stroke, contributing to approximately half of all strokes. But here's the empowering truth: proper blood pressure management can reduce stroke risk by up to 40%. The landmark diet studies conducted by the National Heart, Lung, and Blood Institute demonstrated that dietary changes alone could lower blood pressure as effectively as medication in many people. Physical activity provides another powerful protection mechanism. The World Health Organization recommends 150 minutes of moderate intensity exercise weekly, and research published in the American Journal of Preventive Medicine shows that physically active people have a 25 to 30% lower stroke risk compared to sedentary individuals. This doesn't require marathon running or extreme fitness regimens. Regular walking, swimming, cycling, or even gardening can provide significant protective benefits. Smoking cessation offers perhaps the most dramatic risk reduction you can achieve. CDC research shows that smoking doubles your stroke risk, but quitting begins to reduce this risk immediately. Within 2 years of quitting smoking, your stroke risk drops to nearly the level of someone who never smoked. Our third myth concerns gender and stroke risk. Many people believe women have lower stroke risk than men, but this dangerous misconception ignores the unique stroke risks that women face throughout their lives. The National Stroke Association reports that stroke kills twice as many women as breast cancer annually, making it the 3rd leading cause of death among women. Women face several stroke risk factors that men simply don't experience. Pregnancy increases stroke risk approximately 3-fold, particularly during the 3rd trimester and the 6 weeks following delivery. This increased risk occurs due to blood clotting changes, blood pressure fluctuations, and hormonal shifts that accompany pregnancy. Preeclampsia, a serious pregnancy complication characterized by high blood pressure and protein in the urine, not only increases immediate stroke risk, but can elevate risk for years after pregnancy, according to research published in the journal Hypertension. Hormonal contraceptives, particularly birth control pills containing estrogen, slightly increase stroke risk. This risk becomes more significant when combined with smoking, migraine with aura, or other risk factors. The American College of Obstetricians and Gynecologists recommends that women over 35 who smoke should not use estrogen-containing contraceptives due to increased stroke and heart attack risk. Migraine with aura affects women 3 times more frequently than men and doubles the risk of ischemic stroke, according to the American Migraine Foundation. Women who experience visual disturbances, sensory changes, or speech problems before their headaches should be particularly vigilant about managing other stroke risk factors. Menopause brings additional considerations. The decline in natural estrogen levels can affect cardiovascular health, and hormone replacement therapy, while beneficial for managing menopausal symptoms, may slightly increase stroke risk, according to the Women's Health Initiative study. However, this risk must be weighed against the therapy's benefits and individual health factors. This leads us to our 4th myth, that stroke symptoms are always obvious and dramatic. The reality is far more complex, particularly for women who are more likely to experience atypical stroke symptoms that don't fit the traditional profile. While the FAST acronym remains crucial for stroke recognition, focusing only on facial drooping, arm weakness, speech difficulty, and the importance of time can cause people to miss other significant warning signs. Women are more likely than men to experience sudden, severe headache that's unlike any previous headache, sudden nausea and vomiting not related to a known illness, sudden general weakness or fatigue, sudden dizziness or loss of balance, sudden confusion or disorientation, sudden vision changes, or sudden numbness anywhere in the body. These symptoms are often dismissed or attributed to stress, hormones, or other conditions, leading to dangerous delays in treatment. The American Stroke Association emphasizes that any sudden, severe neurological symptom should prompt immediate medical attention. Remember, during a stroke, nearly 2 million brain cells die every minute, according to neurological research, making rapid treatment absolutely critical. Our 5th myth involves transient ischemic attacks, commonly called mini-strokes or TIAs. Many people believe that because TIA symptoms resolve quickly, typically within 24 hours, they're not serious medical emergencies. This misconception is extremely dangerous. The American Heart Association calls TIAs major warning signs, with about 1/3 of people who experience a TIA having a major stroke within 1 year if the underlying problem isn't addressed. Think of a TIA as your brain's equivalent of chest pain before a heart attack. It's an urgent warning that your brain's blood supply is compromised. TIA symptoms might include temporary weakness or numbness on one side of the body, temporary confusion or trouble understanding speech, temporary vision problems in one or both eyes, temporary dizziness or loss of coordination, or sudden temporary severe headache. The crucial point is that TIAs provide a critical window for stroke prevention. When someone receives proper medical evaluation and treatment after a TIA, research published in The Lancet shows that the risk of subsequent major stroke can be reduced by up to 80%. Treatment might include antiplatelet medications like aspirin or clopidogrel, anticoagulants for people with atrial fibrillation, procedures to open blocked carotid arteries, or optimization of blood pressure and cholesterol management. This brings us to our 6th myth, that all strokes are essentially the same condition. Understanding stroke subtypes is crucial because prevention strategies and treatments can vary significantly. The American Stroke Association classifies strokes into distinct categories, each with unique characteristics and risk factors. Ischemic strokes account for about 87% of all strokes and occur when blood flow to part of the brain is blocked, usually by a blood clot or severely narrowed arteries. These strokes often develop more gradually and may be preceded by warning signs like TIAs. The most common causes include atherosclerosis, where fatty deposits build up in arteries, and cardioembolism, where blood clots form in the heart and travel to the brain. Risk factors include high cholesterol, diabetes, heart disease, and carotid artery disease. Hemorrhagic strokes, while less common at about 13% of all strokes, are often more severe and have higher mortality rates. They occur when a blood vessel in the brain ruptures. causing bleeding into brain tissue or the surrounding spaces. High blood pressure is by far the most significant risk factor for hemorrhagic stroke. Other causes include arteriovenous malformations, brain aneurysms, blood clotting disorders, and certain medications that affect blood clotting. A significant subset of ischemic strokes, accounting for 25 to 30%, are classified as cryptogenic, meaning their cause cannot be determined despite thorough investigation. Recent research published in the New England Journal of Medicine suggests that many cryptogenic strokes may be related to undiagnosed paroxysmal atrial fibrillation, an irregular heart rhythm that can cause blood clots to form in the heart and subsequently travel to the brain. Our seventh myth involves stroke recovery and the belief that improvement has a strict time limit, typically thought to be 6 months after the stroke, while the most rapid recovery usually occurs in the first few months. This belief underestimates the brain's remarkable capacity for healing and adaptation throughout life. The concept of neuroplasticity has revolutionized our understanding of stroke recovery. Research from Harvard Medical School and other leading institutions shows that the brain can form new neural pathways and reorganize its functions even years after a stroke. Healthy areas of the brain can learn to compensate for damaged regions through intensive rehabilitation and practice. Constraint-induced movement therapy exemplifies how targeted rehabilitation can promote recovery long after the traditional window has supposedly closed. This therapy involves restricting the unaffected limb to force use of the stroke-affected limb, and studies have shown significant improvements in motor function even in people years post-stroke. Speech and language recovery also continues beyond the acute phase. Melodic intonation therapy, which uses the brain's music processing areas to help restore speech function, has helped stroke survivors regain communication abilities years after their initial stroke. The key factors for continued recovery include consistent therapy participation, family and social support, the survivor's motivation and engagement, and access to specialized rehabilitation services. Technology is expanding recovery possibilities in exciting ways. Robot-assisted rehabilitation devices provide precise, repetitive movements that help retrain the nervous system. Virtual reality systems offer engaging environments for practicing daily living skills and cognitive functions. Transcranial magnetic stimulation and other brain stimulation techniques are being studied as ways to enhance the brain's natural recovery processes. The eighth myth we need to address is that stroke prevention focuses solely on traditional risk factors like blood pressure and cholesterol. While these remain critically important, emerging research has identified several other significant factors that many people overlook. Sleep disorders, particularly obstructive sleep apnea, dramatically increase stroke risk. The American Academy of Sleep Medicine reports that untreated sleep apnea increases stroke risk by 2 to 4 times. Sleep apnea causes repeated interruptions in breathing during sleep, leading to oxygen level fluctuations that can damage blood vessels over time and increase blood pressure. The encouraging news is that treating sleep apnea with continuous positive airway pressure therapy or other interventions can significantly reduce stroke risk. Mental health plays a crucial role in stroke prevention that's often underappreciated. Research published in the journal Stroke found that people with depression have a 34% higher risk of stroke compared to those without depression. Chronic stress contributes to stroke risk through multiple mechanisms. It can raise blood pressure, promote irregular heart rhythms, increase inflammation throughout the body, and lead to unhealthy coping behaviors like smoking or overeating. Social connections and community engagement have emerged as important protective factors. A study published in PLOS ONE found that socially isolated individuals had a 32% higher risk of stroke. This might occur through several pathways. Social isolation can increase stress hormones, reduce motivation for physical activity and healthy eating, delay seeking medical care, and contribute to depression and anxiety. Environmental factors are increasingly recognized as stroke risk contributors. Air pollution, particularly fine particulate matter smaller than 2.5 micrometers, has been linked to increased stroke risk in multiple international studies. The Global Burden of Disease study found that air pollution contributes to approximately 29% of stroke deaths worldwide. While individual control over air quality is limited, awareness can guide decisions about exercise timing, home air filtration, and supporting policies for cleaner air. Our ninth myth concerns nutrition and stroke prevention. Many people believe that simply avoiding high cholesterol foods provides adequate dietary stroke protection, but the relationship between diet and stroke prevention is much more nuanced and comprehensive. The Mediterranean diet has the strongest scientific evidence for stroke prevention. The landmark Predimed study, published in the New England Journal of Medicine, followed over 7,000 people at high cardiovascular risk and found that those following a Mediterranean diet, supplemented with extra virgin olive oil or nuts, had a 30% lower rate of major cardiovascular events, including stroke, compared to those on a low-fat diet. This eating pattern emphasizes olive oil as the primary fat source, abundant consumption of fruits, vegetables, legumes, and whole grains, moderate amounts of fish and poultry, limited red meat consumption, and moderate wine consumption with meals for those who drink alcohol. The diet's protective effects likely come from its anti-inflammatory properties, beneficial effects on blood vessel function, and positive impact on blood pressure and cholesterol levels. Omega-3 fatty acids, particularly those found in fatty fish like salmon, mackerel, sardines, and anchovies, provide specific stroke protection. The American Heart Association recommends eating fatty fish at least twice per week, based on research showing that omega-3s can reduce inflammation, improve arterial function, decrease blood clot formation, and help regulate heart rhythm. Potassium intake plays a crucial role in stroke prevention through its effects on blood pressure regulation. The DASH diet studies demonstrated that increasing potassium consumption through foods like bananas, potatoes, spinach, beans, and yogurt can significantly lower blood pressure. Research suggests that getting potassium from food sources rather than supplements provides superior health benefits, possibly due to the synergistic effects of other nutrients found in potassium-rich foods. Excessive sodium consumption, unfortunately common in processed and restaurant foods, significantly increases stroke risk by elevating blood pressure. The World Health Organization recommends limiting sodium intake to less than 2 grams per day, but the average American consumes nearly twice this amount. Reading nutrition labels, choosing fresh whole foods over processed options, and cooking more meals at home can dramatically reduce sodium intake. Our final myth is perhaps the most important to debunk because it affects hope and motivation for stroke survivors and their families: the belief that stroke survivors cannot regain meaningful function and quality of life. Advances in acute stroke treatment, rehabilitation techniques, and our understanding of brain recovery continue to improve outcomes dramatically. In acute stroke treatment, the therapeutic window continues to expand thanks to better patient selection and advanced imaging techniques. Mechanical thrombectomy, a procedure where specialized devices remove blood clots from large brain arteries, has revolutionized treatment for severe strokes. Research published in multiple studies in the New England Journal of Medicine shows that this procedure can be effective up to 24 hours after stroke onset in carefully selected patients. Compared to the previous 6-hour window, intravenous thrombolysis with tissue plasminogen activator, the clot-busting drug known as TPA, remains effective when administered within 4.5 hours of symptom onset. Recent research has also shown that certain stroke patients may benefit from extended treatment windows when advanced imaging confirms salvageable brain tissue. Rehabilitation technology is transforming recovery possibilities. Robotic rehabilitation devices provide precise, consistent movements that help retrain the nervous system. These devices can assist with arm and leg movements, gait training, and fine motor skill development. Virtual reality systems create engaging environments where stroke survivors can practice daily activities, cognitive tasks, and movement patterns in safe, controlled settings. Stem cell therapy, while still largely experimental, shows promising early results in clinical trials. Research from institutions like Stanford University suggests that injecting stem cells into stroke-damaged brain tissue might help promote healing and recovery even years after a stroke. However, these treatments remain investigational and are not yet widely available outside of clinical trials. The development of comprehensive stroke centers and primary stroke centers has standardized and improved acute stroke care across the country. These Joint Commission certified facilities ensure 24-hour access to neurologists, advanced imaging capabilities, and immediate intervention options. The implementation of telestroke networks has extended expert stroke care to rural and underserved areas where neurologists may not be immediately available. Recovery outcomes have improved significantly with better understanding of the factors that promote neuroplasticity. High-intensity, task-specific rehabilitation that challenges the brain and affected body parts promotes the formation of new neural pathways. Family involvement in rehabilitation, maintenance of social connections, treatment of post-stroke depression, and early mobilization all contribute to better outcomes. Adaptive technologies and home modifications help stroke survivors maintain independence and quality of life. Voice-activated home systems, adaptive eating utensils, specialized computer interfaces, and mobility aids enable people to perform daily activities despite physical limitations. Occupational therapists specialize in identifying these solutions and training people to use them effectively. The stroke survivor community itself provides crucial support and inspiration. Organizations like the American Stroke Association offer support groups, educational resources, and advocacy opportunities. Many stroke survivors find renewed purpose in helping others navigate their recovery journey, contributing to research, or advocating for better stroke care and prevention. As we conclude our journey through these 10 dangerous myths, remember that knowledge truly is power when it comes to stroke prevention and recovery. Every piece of accurate information you've learned today has the potential to save a life, whether your own or someone you care about. The most empowering truth is that stroke prevention is largely within your control. By managing blood pressure, staying physically active, eating a brain-healthy diet, getting quality sleep, managing stress, maintaining social connections, and avoiding smoking, you can dramatically reduce your stroke risk, regardless of your age or family history. If you recognize stroke warning signs in yourself or others, don't hesitate to call emergency services immediately. Time is brain tissue, and the faster treatment begins, the better the potential outcomes. Remember that even symptoms that seem mild or resolve quickly could be warning signs that require immediate medical evaluation. For stroke survivors and their families, remember that recovery is a marathon, not a sprint. The brain's capacity for healing and adaptation extends far beyond what we once believed possible. With proper rehabilitation, family support, and determination, meaningful recovery can continue for years after a stroke. Share this life-saving information with your friends and family members. Stroke education saves lives, and you never know when this knowledge might help someone recognize warning signs. Seek immediate treatment or make lifestyle changes that prevent a stroke from happening in the first place. Your brain health is one of your most valuable assets, and it's worth every effort to protect it.